All right, everybody wants to talk about the abdominals. All right, very important muscle. Everybody wants to train them. Everybody wants a six-pack. I don't have that. So anyway, not to ask me how to do it. Anyway, four-layer abdominals, the rectus abdominis, most superficial layer. Then the external oblique, they attach here and come down in. They're your true lower abdominal. They have the most muscle fibers down here. They're your true lower abdominal. The internal oblique come and shoot back and come down this way. Look in your anatomy books, you'll see that. The transverse abdominis kind of inside of that rib cage and kind of comes forward and attaches right to the fascia of all that. They're all interconnected through fascial means. They just have a slightly different responsibility for everything. The rectus abdominis, dominant plane sagittal is sagittal plane. It decelerates hip or trunk extension. It concentrically controls trunk flexion, obviously. All right. So if I was to take a step forward, my pelvis anteriorly tilts forward while my trunk stays upright in line because my eye drivers, but I get trunk extension and anterior pelvic tilt forward. That essentially lengthens the abdominal, the rectus abdominis, and all the other ones, but particularly the rectus abdominis. In gait, the external rotators, the right rotator will rotate me counter rotation. The left external oblique will rotate me to the right, it's counter rotation. The internal oblique will rotate me same side or ipsilateral side. Left internal oblique will rotate me to the left side, same side or ipsilateral side. Transverse abdominis, belly button, drawn in, right? Gives you stabilization, very active in breathing, okay? Controls the abdominal content. I'm not a big component of drawing in your abdominals and holding there. I think we have to go a little bit more natural, let it happen naturally. But that's another discussion. That's our level 2 discussion. However, loading essentially three-dimensionally. So if I do a posterior overhead reach, I load my abdominals in the sagittal plane. My pelvis, because they all come down and attach to the front of my pelvis, and they control anterior tilting of the pelvis. They control extension of the trunk. So I'm lengthening those two components, okay, eccentrically. But if I was to do a crunch, I posterior rotate my pelvis and crunch. Okay, so that's our concentric in the sagittal plane. Transverse plane, rotation. There's our obliques. Alright, so if I'm going to turn this way, I concentrically have motion here in the external oblique, but I eccentrically load this oblique. So I eccentrically load it and then contract to power through, and vice versa. And the oblique's the same thing. If I go this way, I get contraction on this internal oblique, while I eccentrically load this internal oblique. And then when I fire through, I get that opposite reaction. Hopefully that makes sense to you. I'm going a little bit quick here. Hard to explain it in this context, but again, that's what our seminars for. So in gait, if I take a step forward, I go into hip flexion. My pelvis tilts forward, my eyes stay level, so I get extension. I load the abdominals in the sagittal plane, anterior tilt, trunk extension. Load in the sagittal plane. My pelvis rotates to the left, only about 5 degrees. My trunk rotates to the right, just the same amount of degrees. Okay, they're at a sync. Okay, and you'll see that later, at a sync. So I load the oblique here, while I load the internal oblique here on the left side. As I step through, I contract the oblique on the right side and contract the oblique on the left side, but then I load the opposite. Of course, my arms are going here. So I have a loading effect in the transverse plane. I'm rotating. My pelvis is rotating one way. I'm at a sync. I'm doing this. My obliques are controlling that. The transverse abdominis, that's supposed to kick on. That's our inner unit of core. That's supposed to kick on when we actually reach and move our legs. Some people, they get shut down. There's a way to train that consciously. But one thing I want, and you'll see it in the plank videos or the plank demonstration, is just using your diaphragm and breathing in through your stomach and exhale diaphragmically. If you integrate your diaphragm, proper breathing, again, level number 2, but we touch base on it, breathe properly, you're going to turn on that transverse abdominis, you're going to turn on that multifidus, and you're going to turn on that pelvic floor unconsciously. We want to develop a breathing pattern that's proper, that's subconscious. I think I gave an example in our questions. Breathing is supposed to be subconscious. That's if people start to breathe abnormally, they'll start to compensate through their other accessory muscles, and that ingrains a pattern. Shuts down your diaphragm, shuts down your core stability. So we want to bring that back into fashion. Have people breathe properly while they're doing their exercises, and you'll train your abdominals correctly. So functional exercises for that is going to be all kinds of chops and things like that, but decelerating all of our, using our drivers, using our reaches to turn them on eccentrically and get a reactive concentric explosion. There's your abdominals.